The following program is sponsored by Memorial Healthcare System.
We're moving health forward with Memorial Healthcare System.
What do we got, Jay?
Raising the bar on stroke care.
In order to be able to save brain, we had to save time.
Life after brain trauma or stroke.
The brain needs to be retrained again, just like when you were younger.
How to prevent cardiovascular disease.
Good sleep practices, movement is medicine, nutrition, hydration, stress management techniques.
Keeping your brain healthy at any age, and the top neurological issues.
I think the future is really bright.
Welcome to Moving Health Forward with Memorial Healthcare System. In an instant, a stroke can change everything. It's the second most common cause of death in the world and the #1 cause of disability in the United States. The good news is that 80% of strokes can be prevented. And over the past decade, medical advances have greatly improved your chance of surviving a stroke. The right treatment, administered quickly, can save both lives and quality of life. Here in South Florida, doctors are working closely with EMS to raise the bar and gain time to save brain.
I was 29 and I was at home postpartum 8 days after having my baby, and I had a stroke.
In the United States annually, there are about 800,000 strokes. Of those, about 80% are what we call the ischemic type, and those are due to blockages of major or smaller arteries in the brain.
I had a severe hot flush inside and like a severe headache, and I had to release my headband at the moment, and then after that, the seizures began.
The remaining 20% of strokes are what we call the hemorrhagic strokes, and those are due to bleeding in the brain from causes such as high blood pressure or a ruptured aneurysm.
I was scared. So my thought initially was, okay, we're gonna call 911. Something was happening and I couldn't talk well, and they needed to hurry.
With a stroke, time is of essence. The faster a patient is treated, the better the outcome. For every minute that elapses during an acute stroke, millions of neurons are at risk for irreversible injury.
Stroke itself is the #1 cause of disability in America. And that's about quality of life. That's about waking up tomorrow and not being able to move your right arm or your right leg or both. There are a number of studies that show that people who suffer stroke oftentimes don't call 911 or wait hours before they do. And it is extremely important for the message to get out that it is okay to call 911 when you're feeling the symptoms of a stroke. The main signs of stroke that people should be looking for are those that follow the acronym FAST.
I don't know what's wrong with them.
Look at the face, the arms, their speech, and time.
Sir, what's going on? Can you hold both your arms up? We have a stroke alert here, guys. Let's load and go.
What do we got, Jay?
Let's go. Left-sided weakness. Get a BGL right away.
We've worked very hard over the last few years in South Florida to educate the paramedics to call in a pre-hospital stroke alert with the stroke-like symptoms, any other pertinent medical history about the patient, and their estimated time of arrival.
We knew in order to be able to save brain, we had to save time. So we had to do things in parallel.
Memorial Regional, this is Rescue 7.
And so we instituted a parallel workflow within our hospital that took into account the information that the paramedics were giving us. Is he on any blood thinners? Something as simple as being able to perform a video evaluation on our smartphones is really helpful when a patient is in the ambulance coming to our facility, such that we are able to lay our eyes and ears on the patient while they're still in the ambulance, assess their stroke-like symptoms, in order to further guide the paramedics to recognize that this could be a severe stroke and also affect our activation of the cath lab as early as possible.
Stroke alert to the adult emergency room, station red.
As we're driving to the hospital in parallel
Dr. Kath, ET by trauma,
is activating their process. They're bringing their team in for the cath lab. They're getting all of their things lined up for us.
1, 2, 3.
They go straight to CT, where immediately we perform the scan of their brain
2 minutes and the scan will be done.
to determine what type of stroke they might be suffering, whether it's a bleed in the brain or a blockage of a major artery in the brain. In South Florida, there has been a proliferation of what we call comprehensive stroke centers. So it means that not only is the center capable of giving the clot-busting medication, the IVTPA, for minor strokes, what we call small vessel strokes, but also the more severe strokes due to major blockages of arteries in the brain, as well as bleeding in the brain. We have 24/7 neurosurgical and neurointerventional capabilities in the cath lab to treat the severe forms of strokes. Now, our door-to-treatment times, once a patient arrives to the hospital, are a third of what they used to be, and that has allowed us to more consistently also get better outcomes for these patients.
Time is brain, and absolutely, with the standardization of protocols, with the collaborative effort between the hospital and the pre-hospital providers, we're seeing door-to-puncture times that have never been seen nationally, definitely not here in Broward County.
Was this a type of case?
Dr. Maeda was the doctor that responded to the call that saved my life. They did a procedure where they removed the clot. According to my doctor, who's my angel, he said that in the table I was already making movements.
To see a patient come in with complete paralysis of one side of their body, inability to talk, inability to understand what others might be saying to them, and within an hour of the treatment, to be able to see that they're now able to fully lift their arms and legs that were previously paralyzed, that's a feeling that's unmatched.
Thanks to him, my kids have a mom. My family has me.
Did you know stroke risk increases with age, but strokes can and do occur at any age? Brain trauma and stroke can have devastating effects on the body, but technical advances in rehabilitation are transforming the survivor's journey into a new normal.
It was January 19th of this year. I was at home, ready to go into the shower, and my focus started to leave me. And he came in, and he saw that something was very off.
It was February 7th. And my niece tells me, "Uncle, your face is drooping, you're having a stroke." And then little by little, I started losing my left side. And my niece screamed, "Help, he's having a stroke."
We see a lot of different injuries to the brain. The most common is a stroke, but we also see traumatic brain injuries from motor vehicle accidents, from falls. We can see a whole variety of injuries that affect and impact the brain.
Traumatic brain injury, or TBI, is simply any injury to the brain that causes a disturbance in the normal physiologic function of the brain. That could be anything from a period of loss of consciousness to changes in cognition, memory, muscle weakness, sensory impairment, trouble with vision, language, speech.
The reality is it could happen to any of us. We don't usually leave the house thinking that, oh, today's the day I'm going to have my stroke or I'm going to get in a horrible car accident. But yet it can happen.
I could not lift a toe, couldn't move my toes, my fingers, nothing on the left side.
One of the real strengths of the Memorial Rehabilitation Institute is we have some of the most current and most sophisticated technology in the rehabilitation field to help our patients.
I started doing occupational therapy, physical therapy, and speech therapy. Little by little, it was 90 minutes each therapy, back to back to back, every day.
The brain needs to be retrained again, just like when you were younger. So having you do particular movements, walking, talking, eating, that causes rewiring of the circuitry of the brain, and doing that more often, more frequent, in more specific fashion, all results in better recovery.
There you go.
We use virtual reality with a lot of different activities for the patient to accomplish the task in the virtual world that they can't do in the physical world. It's an environment where we can teach people how to safely, physically maneuver different activities, as well as cognitively can they perform in those situations like a grocery store. So the goal is always to try to get patients as independent as possible so they can return to a functional, productive life.
I can walk, I can get up, I can go up and down the stairs by myself. I can get dressed by myself.
Music therapy is one of the evolving fields within rehab. Sometimes patients that we have difficulty reaching in other ways will respond to the music.
Another wonderful thing that they provide here is that therapy dog, and that really does lift you up when you're feeling down.
This is what I tried to show you.
Rehabilitation is certainly not an individual sport. It takes an entire team of very well-trained professionals to accomplish this task, but part of that team really includes the patient and the patient's family.
I always remain positive. My network, my family was always by my side. My faith in God.
It's a whole combination of the care here and the support here and a little help from higher power.
That's so essential to have that entire team of support to move the patient forward. So to see somebody who thinks life as they know it has ended, to see them transition to step by step gaining more function and then getting that hope back that, you know, life will continue, it's not so bad, is an amazing feeling.
The perspective of life changes. I have a second chance of life. There's no time to waste. Gotta do the right thing and focus on what's really important in life.
There's certainly been severe cases, and they end up 6 months or a year later coming back to the office, joyous, second chance at life, doing more probably amazing things than before.
It's a little bit of a different world. It's a little bit of a new normal. Since the stroke, I'm thankful every day for all that I can do, and I don't take anything for granted.
Ask the neurologist.
How do you know if you've had a mini stroke? Are there ways to find out yourself, or do you have to have testing done?
There's nothing mini about a stroke. We use a term in medicine called a TIA, that stands for transient ischemic attack. So if somebody has a spell, suddenly, a sudden onset of weakness or numbness, slurred speech, double vision, difficulty swallowing, that lasts for a few minutes, even a few hours, and then goes away, that's a TIA. It's very important to come to the hospital if somebody is suspected of having a TIA. The treatment all depends upon the tests that are done within the first few hours of finding out of these symptoms.
The vascular system is like our body's highway, veins and arteries that circulate blood to and from the heart and brain and throughout the body. So what can we do to keep these vital lanes running smoothly and prevent cardiovascular traffic jams, which can result in heart disease and stroke?
Juan, thank you.
Recently, at the NBC6 Grand Family Expo, Dr. Oz and a panel of Memorial Healthcare physicians discussed what role lifestyle plays in keeping the human vascular system running full speed ahead.
The beautiful thing about the heart is you can affect its signs and symptoms in so many ways.
We know that cardiovascular disease, heart disease, is underlying at its very core an inflammatory condition. So integrative medicine uses a preventive model to address preventing heart disease. It's everything from good sleep practices, movement is medicine, nutrition, hydration, stress management techniques to actually reduce the inflammatory burden.
Explain, Dr. Mehta, how sleep affects the heart and give them some tips for sleep hygiene.
So oftentimes, if we don't get a full night's rest or if we have a little interruption in our sleep, we start to develop anxiety about sleep itself, and that's what can lead to insomnia. Now, oftentimes, what we want to get to is that precious REM sleep. So during REM sleep, that actually dissolves away inflammation. And so those deeper stages of sleep are anti-inflammatory in nature, and that's how they really help to prevent heart disease. To get to that REM sleep, we need to watch our caffeine intake. We need to do some relaxation exercises as part of a good bedtime routine. We need to limit our exposure to bright screens and these electronic devices that are designed to stimulate the arousal center of the brain and are not compatible with good sleep.
Eli, if you had to pick ways of sleeping better, where would you put exercise? And does it make a difference what time of the day you exercise and what kind you do?
So the more exercise you do, the better you're going to sleep at night. First thing in the morning's great, your energy's great, your body's hormones have sort of spiked at that point in time. But we know the more exercise you do, the better you're going to sleep at night.
What kind of exercise do you recommend?
I recommend anything. So if you want to go for a 5-minute walk, that's better than sitting on the couch. But to me, 20 minutes sustained cardiovascular exercise. Get your heart rate up. Don't worry about the numbers. Be able to have a conversation, but be sweating with it too. That simple exercise you're going to do on a daily basis are going to modify your sugars, are going to modify your cholesterol, are going to modify your blood pressure, are going to decrease your weight. They're going to get all those risk factors away from you. So exercise is pivotal for your health. It's complementary, if not better, than your cholesterol medication, your aspirin, your blood pressure medication. It's a medicine we have to take every day. So just to add on to what just Eli said and also Dr. Mehta said, very, very, very important, okay? Keep this lifestyle modification in your mind. Do not smoke. Weight control, good physical activity, good dietary habits, control your sugar, control your cholesterol, control your blood pressure, and you will beat cardiovascular disease.
Oftentimes, inflammation sneaks up on us, and one of the mainstays of our anti-inflammatory approach is nutritional practices, and we like to keep it as simple as possible. Less meat, less dairy, less wheat, processed grains, less sweet sugar, more roots, fruits, leaves, and flowers. Roots are carrots, beets, turnips, radishes, ginger, turmeric. Fruits to your heart's content. Leaves are the spinach, the kale, the green tea, and then flowers are the cruciferous vegetable, the broccoli, cauliflower, asparagus, Brussels sprouts.
Simple little tactics in your own life, day in and day out, add up. There is power of mindfulness, of being aware. I would love if you could explain to people generally mindfulness, a little bit about meditation, and what do you do in your own personal life?
Mindfulness is simply making it a point to put a little space in your day for yourself. And mindfulness has so many different aspects to it. There's breathing exercises, guided imagery, creative visualization, affirmations, devotional practices. All of these things are sort of within the areas of mindfulness because they have the same biologic anti-inflammatory results in the body. Find a technique that you enjoy. And most importantly, create that space in your life for just a few minutes where you can be alone with your thoughts and enhance your self-awareness.
We also support each other in doing this because we know that it makes us better physicians, it makes us better husbands, makes us better sons, makes us better fathers. And we have to take care of ourselves so that we can take better care of our families and our patients too.
Did you know regular exercise is one of the most important things you can do for your health? As we age, so does our brain. So how does that affect the way we think? And what can we do to keep our brain healthy and stay sharp?
If you just look at a brain physically, externally, you'll see that somebody's brain as they age literally shrinks. There's what we call atrophy of the brain over time. And what that means, if you look at it under the microscope, is that the connections between the nerve cells, there are fewer of them. We're losing them.
And so the brain of a 30-year-old is much larger in volume than the brain of a 50 or 60-year-old. And that's dependent on several factors, one of which is what we advocate about cardiovascular health. We encourage a lot of physical activity, as physical activity tends to improve the oxygenation and nutrient supply to the brain.
Exercise is the number one thing that we can do to keep our brain healthy. Keep your blood flowing up into your brain will improve its health over time.
Tap the E. We know now that patients who have dementia and they exercise for 10 or 15 minutes every day, they have significant less progression of their disease over years compared to someone who doesn't do the exercise. Another thing is the diet, eating healthy, balanced diet. There are a few studies that have shown that eating Mediterranean diet that's rich in protein and rich in essential oil can help to improve the memory and improve the cognitive function of the brain. We have really to do our best to take care of our brain, and that starts early as maybe when you are in your teens or 20s.
Fitness has been a part of my life probably since I was in high school. Fitness is pretty important to me, and it's something that's fun, so I like to work out.
How many days a week do you work out?
I would say 3 times a week for strength training and cardio every day, 5 times a week.
Why is it important now as an adult, now that you're graduated, to start teaching people how important exercise is?
It is something that I started early, and because of that, I want to continue on that path, regardless of age. You can always start exercise no matter what, and you can see your own benefits in terms of that.
As the brain ages, we see that memory loss,
Two hands, dos manos.
The mental sharpness, mental quickness, the ability to organize and order things starts to diminish a little bit. So we try to help our seniors to really keep those skills sharp and keep them fresh. We've started senior programming here in 1996 at Memorial Healthcare System. These seniors want to be active, and we want to be able to provide that platform for their activity.
Number 18. There are games, there are cards, you name it, board games, whatever anyone wants. And that really keeps our minds stimulated.
We're gonna work on balance.
Social interaction is really important for seniors, not only to keep their minds active and healthy and alive, but also for their mood, to keep them from having depression as they age.
This is a good service.
They do have a lot of life left in them and a lot of purpose too. We have a lot of seniors that do a lot of community outreach, go to local schools, child care centers, daycare centers, nurseries, just to give back.
I started after my wife passed away, and they helped me with bereavement. And now I help out with bereavement.
We all age, we all get old over time, but I think regarding health and brain, it's not about the age, it's about how you treat yourself. For sure, stress affects your immune system. It can be associated with multiple diseases and is considered the major trigger for headaches, for migraine. Is really having a healthy lifestyle, exercising, eating well, sleeping well, taking a good care of yourself, being active and being happy. I think then you will help not aging your brain.
Ask the neurologist.
Would I have a problem if I keep on forgetting more and more each day? Should I be concerned about that?
I think the concern comes when there is like a decline. If there is a clear decline in your memory, for instance, you lose a skill that you were able to do very well before, that's when you should probably be concerned. It could be a degenerative disease.
Living with a neurological condition can be a challenge for patients, their families, and caregivers, but advances in neuroscience and medical treatment offer new hope for today's top neurological concerns.
For me, having to live with epilepsy, it was a life of caution. For my parents, I really think they were scared every single day.
Epilepsy is defined as increased risk of having frequent seizures. It's the third most common neurologic disease in our community.
I had an accident while driving. You have a seizure while you're driving, and I pretty much went unconscious at the wheel. That put me in the mindset of, I need to get rid of it now.
Now we are using a minimally invasive technique in order to define where the seizure is coming from and provide a very complete resection of the seizure focus.
I've been seizure-free since last December, a little over a year now, and it's a whole new life. Being able to drive to work every day, being able to have the job that I have now, I'm very thankful for it.
Alzheimer's disease is a specific cause of dementia. 50% of dementia is due to Alzheimer's disease. We all have trouble with memory. You walk into a room, you don't remember why you went into the room, it comes back to you later. We call that memory delay. As long as it comes back to you eventually, then it's okay, it's normal. If memory is lost and it stays lost, that's never normal. And if you have progressive loss of cognition, in 2 or more types of cognition, that's the definition of dementia. There are medications that can help to delay the progression of disease. They do not make you better. They slow down the memory loss a little bit. People who do regular exercise have a much better chance of avoiding dementia. And that's our #1 thing that we can do. A diet that's high in olive oil and with nuts, the Mediterranean diet it's called, is supposed to be helpful as well. It's a devastating illness not only for the patient, but really for the family and the caregivers. It's important that the caregivers and the family get the understanding and the help that they need to deal with this.
Multiple sclerosis is an autoimmune condition that affects the brain and spinal cord, which is the central nervous system. One of the greatest breakthroughs and advances that's happened in multiple sclerosis is the development of therapies for progressive multiple sclerosis. So now with the ability to decrease the progression of disease, we hope that patients have less disability down the road and less need and dependence on other people and assist devices.
Parkinson's is a neurodegenerative disease. There's a certain part of the brain that's breaking down.
So everybody come up, let's go.
So today we have the Parkinson's class.
Keep those arms up.
And it's free for all participants with Parkinson's disease and their caregivers.
Energy, energy.
The main symptoms of Parkinson's are tremor, stiffness, slowness, and trouble with balance.
I used to be able to run, walk, take long walks. I can't do long walks.
Pivot foot 2.
We can give medication and we can do physical therapy and exercise. The medication does not treat the underlying disease.
There you go.
The class is designed to stimulate physical activity, some mind games for their mental capacity, work on balance, strength, endurance, some stress management.
We had fun. We needed a little fun in our lives.
You should feel very proud of yourself for putting the work in.
Very good.
The elderly population is growing. The amount of people in our population that will be developing degenerative brain diseases will be increasing. We have to prepare for this. The medical community is knowledgeable of this, but society as a whole has to be aware of this, of caring for our elderly patients.
Headaches, for instance, the tension type headaches, is really just a pain. It's a pain in the head or a headache. And migraines are much more than only a headache. The approach of a patient with migraine should be really individualized because it depends on the frequency, the intensity. There is a lot of options of treatment. We have medications. There are some supplements that might work for the right patient. We have also, more recently, devices that they can be wear and they modulate the pain. We do Botox for patients that have migraines more than 15 days per month. There's so many discoveries, so many options available for patients. I think the future is really bright.
Thank you for joining us on Moving Health Forward. Until next time, keep your checkups, exercise, eat healthy, and be good to yourself. For more information on today's topics, visit NBC6.com/movinghealthforward.
The preceding program has been sponsored by Memorial Healthcare System.